The truth about screen time and your child's behaviour. Are you worried about how screen time is affecting your child? If so, you are not alone. As a parent myself, I can't help but wonder about the unknown dangers of screen time and how it affects my children. Over the past few years, I've seen more and more parents coming to see me with concerns about screen time safety and wanting to know when and if they should be worried. Most of us will let our children use screens. They can be necessary for those long car journeys or when you need 15 minutes of quiet to get an essential task done. They can also help children to learn and have been linked with increased language and cognitive skills. But how much screen time is acceptable and how much is detrimental to children? Today I'm going to discuss exactly how screen time affects brains and the evidence behind 5 commonly associated dangers. Make sure you watch until the end, where I will discuss what leading health child authorities and organisations have deemed to be safe levels for various age groups. I'm Dr. Gina, and over my 15 years as a paediatric doctor, I have used evidence-based medicine to help and advise thousands of families on parenting issues. Have you ever noticed your child's getting irritable or cranky when you take away their screen or tell them to stop playing a video game? Absolutely. So why does this happen? There are 3 key reasons that I'm going to share with you now. 1. Dopamine release. Any screen time triggers the release of dopamine, a feel-good neurotransmitter that makes us associate screen time with being happy, and therefore our brains crave more of it. Once we stop watching, the dopamine release stops and can make some of us, especially kids, more irritable. This is exactly the same mechanism we see in many other addictive behaviours. 2. Brain immaturity. Kids' brains are still developing, so they are not great at transitioning away from any activity. If they are enjoying watching or playing on a screen and it's taken away, they are likely to have a meltdown. The longer they use screens, the more pronounced this behaviour will be. 3. Lack of self-regulation. Kids do not have the ability to self-regulate. They do not have the maturity to think, I've had enough screen time now. Their brains are more geared towards instant gratification and rewards, which is exactly what screen time provides. The self-regulation starts developing at around ages 8 to 13, but can be later for some kids, and brains do not fully mature until our mid-20s. All of these reasons explain why those tantrums, meltdowns, and poor behaviour happens when screens are removed. You should remember that the more screen time your child has, the more their behaviour will be affected. There are lots of circulating rumours about screen time and how it damages our kids, which can cause a lot of anxiety for parents. We all want the best for our kids, but how can we be sure that we are not causing them harm? I'm now going to share the 5 most common questions that parents ask and provide you with the evidence and the facts. 1. Does screen time cause ADHD? Studies on children's brains whilst using screens have demonstrated that artificial light and flickering images can overstimulate certain parts of the brain, leading to issues with attention and focusing. To be clear, screen time does not cause ADHD, but 5-year-olds who spend more than 2 hours a day on a screen are 5 times more likely to be reported by their parents as being hyperactive or having poor attention. 2 common behaviours seen in children with ADHD, attention deficit hyperactivity disorder. 2. Does screen time affect sleep? Children who use screen time for 2 hours or more per day are likely to sleep less and have more disrupted sleep. At night, melatonin, a sleep hormone, is released. Blue light from screens inhibits melatonin release and therefore can delay sleep. Screen time also makes our brains more alert, so if it's used before bed, it can make it harder for our bodies and brains to relax and let us sleep. 3. Will screen time make my child overweight or obese? Not directly, but indirectly, yes. This is because excess screen time takes away time spent on being active. Over time, that extra 2 to 3 hours a day of being inactive will build up and can increase the likelihood of your child being overweight. Screen time is also associated with consuming more calories and mindless overeating, which we're all guilty of. But eating excessive calories and being less active will inevitably cause issues with weight. We also know being overweight is associated with a whole range of other medical problems, such as diabetes, some cancers, and poor mental health, so it can have a domino effect. 4. Can screen time affect school performance? Indirectly, yes. Firstly, lack of sleep or poor sleep absolutely will affect concentration and cognitive function the next day, so it can have an effect on your child's performance. For younger kids, excessive screen time can take away time from playing. Playing is crucial to your child's development. Play helps them to problem solve and learn and develop. Young children, especially before the age of 2, do not learn from screens. They learn better from face-to-face interaction and through exploring. If they are not getting ample time to do this, then yes, studies show it will impact cognitive function and development. Can screen time make my child more violent? This is a difficult one. Studies do not give a clear answer. Generally speaking though, long-term exposure to violence through video games can make some children more aggressive and violent. There is some evidence that repeatedly watching violent acts can desensitize your child to violent behaviour. Even though the evidence is not clear yet, you absolutely should make sure that you monitor what your child is watching and playing and expose them to age-appropriate content and games only. It's important to state that we know that not all screen time is bad. In over 2-year-olds, educational apps and programs can actually be beneficial. With emerging evidence and research on both the benefits and dangers of screen time, leading health organisations like WHO, World Health Organization, and the American Academy of Paediatrics have come up with various guidelines on screen time for various age groups. As a parent to a 2-year-old and 9-year-old, I personally know imposing limits can be very difficult. The truth is, we live in a world which is very digital-centric and screens are not possible to avoid. Looking at the evidence, it's clear that the risk of the dangers are directly associated with the length of time children are on screens. Understanding how screen time can affect kids' brains and how they respond will help you as parents understand the need to limit and regulate screen time. As long as you ensure screen time is not displacing essential activities such as playing, exercises, sleeping, and face-to-face learning with the real world, your child will be fine. So now we know the truth behind the associated dangers. In my next video, I will be discussing essential steps parents can take to ensure safe screen time for your kids and how to successfully impose these limits. I hope you found this video helpful. Dr. Gina Parenting is an evidence-based learning platform which analyses the most common issues that parents face and delivers correct and accurate information based on clinical research and evidence. This empowers you as parents to make the best possible parenting decisions for your child based on information that you can trust. To check out more videos, please subscribe, like, and post a comment. Please visit my website to download your free parenting guide for 1 to 5-year-olds. If there's an interesting topic or something you would like to see covered in a video, please let me know. Thank you.